The 6 kinds of people who should never use apple cider vinegar. Blackdoctor.org, where wellness and culture connect. We hear it all the time from people who say, apple cider vinegar is great for this and great for that. But did you know that taking this magical spoonful can also have some serious side effects? While apple cider vinegar has numerous potential health benefits, it's also essential to be aware of its potential risks and side effects. Topical application of undiluted apple cider vinegar can lead to burns, irritation, and discomfort due to its high acidity. And for those with stomach ulcers, consumption of acidic foods, like apple cider vinegar, can exacerbate the condition. Consumption of ACV may result in lower potassium levels, reports a 2020 review in the European Journal of Nutrition, which can result in heart health concerns. ACV may also interact with certain types of drugs, potentially altering their effects on the body. Particularly, it may affect diabetes medications, diuretics, and certain heart disease medications, according to the National Library of Medicine. Before we get into who and when you shouldn't take it, let's find out what's really in ACV. What's in apple cider vinegar? Raw apple cider vinegar contains acetic acid, which can kill harmful bacteria. ACV is about 5% to 6% acetic acid. Natural probiotics, which can improve your immune system and gut health. Antioxidants, naturally occurring substances that can prevent damage to your body cells. Both pasteurized and raw apple cider vinegar are sold in stores, but for health purposes, most people use the latter, the kind that's a little bit cloudy. The cloudy sediment in the bottom of the bottle, sometimes known as the mother, contains more natural bacteria and yeasts. Certain groups of people should exercise caution when considering the use of apple cider vinegar. Pregnant and breastfeeding women, for instance, should use it sparingly since there's insufficient research to confirm its safety during these periods. Individuals with diabetes, particularly those on insulin or other glucose-lowering medications, should monitor their blood sugar levels closely due to the vinegar's potential to reduce blood sugar. People with a history of gastric ulcers or acid reflux may find that apple cider vinegar exacerbates their symptoms. 6 times you should not take apple cider vinegar. Here are 5 times you should never take apple cider vinegar. 1. If you are having trouble swallowing, the inside of the mouth, the throat, and the esophagus, the tube that leads to the stomach, are lined with mucous membrane, a type of tissue that can burn when exposed to acid. Taking apple cider vinegar every day, especially if you don't drink enough water when taking it in tablet form, or if you don't adequately dilute the liquid, can cause throat pain and make it difficult to swallow. Take a look. Can apple cider vinegar really help you lose weight? There have been reports that apple cider vinegar tablets can cause burns, which can cause permanent damage to the throat or esophagus. Heartburn and nausea are also possible side effects. 2. If your potassium level is low, apple cider vinegar can cause potassium levels to fall. Low potassium, medically termed hypokalemia, can cause heart arrhythmias, muscle weakness or breakdown, constipation, fatigue, or paralysis that can interfere with breathing. If you take medications that can cause low potassium levels, such as diuretics, do not take apple cider vinegar without talking to your doctor first. 3. If you're taking diabetes medication or supplements, apple cider vinegar can lower blood sugar levels in people with diabetes. Research suggests this effect may be because it slows down gastric emptying. Apple cider vinegar may also improve how well your body absorbs carbohydrates, which further affects blood sugar levels. 21. Taking apple cider vinegar with other medications that lower your blood sugar may increase your risk for hypoglycemia. Point 1. Examples of blood sugar lowering medications include glucophage Riamay, or Glumetza glucotrol, insulin, Ozempic, or Wegovy. Herbs and supplements that can lower your blood sugar include cinnamon green tea, Momordica carrantia, cardiac glycoside. Herbs and supplements are used to treat heart conditions such as atrial fibrillation or heart failure. These supplements are related to the prescription drug digoxin and have similar side effects. Examples of these herbs include foxglove, oleander, and lily of the valley. Similar to digoxin, taking high doses of apple cider vinegar with cardiac glycosides can lead to dangerous side effects related to low potassium levels. Must read: 101 things that apple cider vinegar can be used for. If you have a history of blood clots or diabetes in your family, while apple cider vinegar has benefits, it could also cause an increase in episodes of hypoglycemia or low blood sugar in diabetics. If you have diabetes, ask your doctor about how to take apple cider vinegar and monitor blood sugars carefully to avoid hypoglycemia. If you already take blood thinners, or if you have problems with blood clotting, do not take apple cider vinegar without your doctor's approval. 5. If you have gastrointestinal problems, since ACV is high in acidic content, it can cause serious diarrhea, indigestion, and heartburn. If you're using ACV for detoxification, these side effects are very common. According to experts, consuming unrefined ACV with a pH level of 5 to 7 restricts these side effects. If these side effects do not seem to evade over time, discontinue or lower your dosage. 6. If you have sensitive teeth oral health problems, the high acidic level of undiluted ACV can destroy your tooth enamel when consumed orally. Besides giving a yellowish tinge to your teeth, it increases your dental sensitivity as well. In order to avoid direct contact with your teeth, consider consuming liquid ACV using a straw. Mix the ACV with juice or water before consuming. That way, you'll be able to lower the possible side effects of vinegar consumption. A viable option to lower the potential damage to your tooth enamel is to brush your teeth soon after vinegar intake. Published April 11th, 2025, April 11th, 2025 by Dr. P. Gould.